Hey everyone, it's your boy KP here. So shout outs to Democracy Now for doing this particular story here that you're about to see. They interviewed Dr. Abdul Sayed, and shout outs to Dr. Sayed El Sayed, Abdul El Sayed, for talking about the plight of poor folks, especially in the Detroit area. A lot of times, we were we are focused rather on certain places, and we forget that there are places that have been dealing with challenges even before this crisis. So he's highlighting how corona is hitting Detroit and other places where people were already struggling, and it's a conversation that people are having now in terms of what kind of stats do we have or report in terms of how people are being treated in this particular situation. For me, I think they're not gonna be treated well. As in times of good, they're not treated well, and in times of bad, definitely not. But anyways, take a listen rather to Dr. El Sayed, Abdul El Sayed. And look in the description box and you'll catch the full story from Democracy Now. Shout out to that news outlet, man, for always focusing on the challenges of the poor. All right, it's your boy KP.
Like a few weeks ago, in other newspapers, of course, as well, that running water will be temporarily restored to thousands of poor Detroit residents disconnected due to unpaid bills. Disconnected to the water supply of Detroit amidst an outcry about the public health threat posed by the pandemic. At least 141,000 Detroit households were disconnected since 2014 as part of a widely condemned debt collection program, according to records obtained by The Bridge news magazine. Just last year, taps were turned off in more than 23,000 homes, 3/5 of which were still without water by mid-January. So can you talk about the significance of saying they're temporarily being rehooked up? Because you so well describe in your book the way this pandemic has exposed the fissures of inequality and health inequality in this country.
Yeah, when you look at communities that are suffering the most, they're communities on which environmental injustice, structural racism, and their implications on poverty have already softened the space for the incoming of this virus to devastate people. You think about something like water. The fact that a mayor or a governor have to be thinking about turning water back on suggests that they're already playing from the back foot, because water should already be on. It should never have been turned off. It's one of the most frustrating things about the system of corporate capitalism in communities like Michigan, because what we do is we, in effect, ask poor people to pay exorbitant rates for basic things like water, to pay off debts that governments well before them incurred. Look at the situation in Detroit. The reason that people had their water shut off is because during the municipal bankruptcy in the city of Detroit, which, by the way, had a lot more to do with white flight and the resulting loss of a tax base, during that municipal bankruptcy, it was agreed upon that Detroit had to pay debts for their water authority that, in effect, had actually purified water for the entire region. So Detroiters were literally having to pay back the debt that the entire region incurred because Detroit was the single utility purifying water for everybody. And then they just raised rates, and when people couldn't pay them, they just shut off people's water. You think about the logic of this, right? And the realization that water should just be a human right for people. It should just be there for people. And then you fast forward and you think about the incoming pandemic, and we're telling people to wash their hands with warm soapy water for 20 seconds. Well, if you don't have water in your house, you can't do that. All of that is seeded by decisions that have been made, that have been patterned around race and patterned around wealth for a very long time. And that's why I talk about this epidemic of insecurity as being what laid the groundwork for the incoming pandemic. And if it wasn't a pandemic like this, it might have been a climate event. But we are not well situated to be able to handle these challenging circumstances that we're going to see pitched at us. And it's the reason why we have to build a robust federal government that can take these things on and prevent them when they're small. And more importantly, build the kind of social infrastructure for people, the kind of social safety net that says that you're not going to be evicted if something bad happens to you, that you're not going to lose your water simply because you can't pay exorbitant rates, that your kid is not going to have to take hundreds of thousands of dollars in loans to go to college, that you can get health care if and when you're sick. Number one, the idea that 10% of your population doesn't have health care at all, or another 50% on top of that have a deductible that's so high that they've learned to ignore symptoms like a fever and a dry cough, which, by the way, are the symptoms of COVID-19, because they know that if they do go and seek medical care for those symptoms, that they'll be hit with a bill on the back end. That's a really dangerous state of affairs when you've got an incoming global pandemic. But even beyond that, I just want you to think about the structure of our health system. Hospitals make money in this system on elective surgeries. That's how they get reimbursed from insurance companies. But if you've got a global pandemic that's about to hit your hospital, what's the first thing you cancel? Elective surgeries. And so now you've got hospitals that not only are trying to staff up and be ready for one of the most serious public health crises of our time, but they're also battling bankruptcy on the back end because they've lost their main source of pay. All of that is because the system is run for profit. Here's the other part. We keep hearing about doctors going without PPE, personal protective equipment. And part of the reason why is because I've talked to business consultants who told them that the best way to supply your hospital is what we call just-in-time supplying, meaning you don't want to have a bunch of stuff laying around because you don't know when you're going to use it. That's all overhead you can strip away. But here's the problem. Well, when you're hit with a pandemic, just in time doesn't work because all of a sudden everybody's trying to get the resources that they need. Just in time is a classic page out of a business consulting manual. When you run hospitals like a business, you forget the fact that they're actually supposed to be there to save lives. And the third point is this. There is no incentive for prevention in our system. Why? Because our system makes money on people getting sick, right? You can't actually bill something if somebody does not get sick, so that you can bill them for the care. And so if you look at just the way the system is set up, there's very little incentive to talk about prevention. And that's why we keep seeing budgets get cut for institutions like the CDC or local health departments or state health departments, because it just doesn't fit within the incentive structure of our health system. Imagine we had a system that actually rewarded keeping people healthy rather than taking care of them after they get sick. That's what Medicare for All would have done. And one last point, we keep hearing this comparison between us and Italy. And since when did we start comparing ourselves with Italy? When was that the comparison? The fact of the matter is Italy is a far smaller country. And even then, we just surpassed them in terms of the number of COVID cases. And it's looking like over the long term, our cases are going to skyrocket well beyond what Italy experienced. We have a responsibility to learn from this moment and realize that we've got to guarantee everybody in this country health care. And if we don't, we will continue to be vulnerable to these kinds of massive public health crises.
Dr. Abdul.